Anecdotally, I have heard from many that these laws are impacting recruiting of young women and professionals into our state in general. I have friends that will say they are grateful that their daughters are spending their 20s in other states because they are concerned that in a pregnancy diagnosis or complication, even though they are not seeking an elective abortion, they cannot get the care that they need here. And we are seeing that recruiting impact across all professions when it comes to the state and our economy. But I want to ask you specifically about OB-GYNs. Are you seeing that these threats of prosecution, this litany of civil and criminal liability against physicians trying to use their reasonable medical judgment, is keeping this state from recruiting the best quality of physicians for the future of every Texan?
So what I can say is that, in hearing from anecdotally from our hospital leadership, right or wrong, there has been it is now a significant challenge to try to recruit OB-GYNs to come to this state. It's just not happening, is kind of what we've been hearing. As far as numbers are concerned, I don't have specific numbers from THA, but in looking at the Bureau of Labor Statistics, in 2022, Texas had 1,550 OB-GYNs. As of 2024, that was 940. That's approximately about a 39% decrease.
And that impact
And so it's
ripples.
basically to the extent that someone feels that they can't come and practice here because they're afraid or whatever the case may be, they're confused. The hope is with HB 44, we alleviate that fear, we alleviate that confusion, and so that, they'll feel comfortable to come here, not retire or whatever the case may be, because they know the standard that they are dealing with and that they can use their reasonable medical judgment, evidence-based medicine to treat these patients.
And we have seen that, again, reporting is we've seen a 56% increase in maternal mortality since the passage of these laws. We don't have clear data because the state is not producing the data. You cannot give us data because you have HIPAA. We're dependent on people telling their story. And again, in this recruiting, this anecdotally impacts women's health care across the board, regardless of an issue of choice, correct?
I mean, if the less OB-GYNs we have in the state, the less access we have.